All atypical ribs, 1, 2, 11, 12, do not have a crest. And as a result, their head contains only a single facet. So rib 1, this is a rib 1, this is a rib 2, 11, and 12. All their heads have a single facet. Rib 6, which is a typical, 2 facets. Here, just 1. You see 1. Okay. So that's one important feature of that all atypicals have a single facet, no crest. Rib 1 also has a tubercle, so a single facet, tubercle, neck here, narrow, has a very sharp costal angle. See, it doesn't kind of like smooth, gradually turn, it goes and then turns sharply. So a sharp looking costal angle, and the shaft, as you saw in rib 6, the shaft is long here and not so wide, like roundish in cross section. Here, rib 1, it's very flat. So instead of being round in cross section, it's flat. So it's very flat and broad shaft. Okay, that's rib 1. So single facet neck, tubercle, very broad and flat shaft. There's the site of articulation of cost cartilage. Here there is a tubercle, a little bump that sticks up, and that's called scalene tubercle because a muscle called scalene attaches here. Okay, there's a muscle attachment here. On two sides are grooves. The one closer to the end that attaches to costal cartilage is called groove for subclavian vein. The one that's closer to the head, towards the vertebral column, behind the costal, the scalene tubercle side, that's the groove for subclavian artery. So subclavian vein passes here, subclavian artery passes here. Next we look at rib 2. Rib 2 is exactly like a typical rib. The difference, so it has a head, a neck, a tubercle, long costal angle, and it's not flat. In cross section it's also round, just like a typical. Difference again, its head only has a single facet. Another difference, just like rib 1, it has also a tubercle, a scalene tubercle, also site of attachment of scalene muscle, or scalenus muscle. Okay, rib 11 and 12 are the last ones. One of the features, both of them lack a tubercle. See, all here had these little bumps here, rib 2, rib 1, and a typical. Ribs 11 and 12 lack those. Their heads have a single facet, no tubercles. Rib 11 has a neck, costal angle, everything's fine. Rib 12, very straight, no costal angle. See this? So no tubercle, no costal angle, no neck. See, there's a neck here. Okay, and no scalene tubercles or anything like that. So that's those are ribs 11 and 12. Now we will look at the final joint, and that is the joint of the ribs with the vertebral column. Okay, so here is a top view. This is supposed to be the sternum, costal cartilage, costochondral joints, sternocostal joint here, costochondral joint, cost cartilage, rib, bony part. So here, let me get there. So here is the rib going back, and this is the vertebral column. From the tutorial on the vertebral column and the bones, you might remember that you may remember the vertebral body here, the transverse processes, the spinous process, and there should be, I forgot to add, the superior articular processes. Okay, coming out. This is what kind of a bone is which part of the vertebral column this is from? It's from the thoracic region. Why? How do I know? Because first of all, the ribs attach only to vertebral bones of the thoracic region, and also the features of the vertebral bone, which we said in the previous tutorial, so you have to look that up. But if the rib attached to it, it's part of the thoracic vertebra. That's why there are 12 thoracic vertebrae, one for each rib. There are 12 ribs. So this joint here, this is the sternocostal joint between sternum and this end of the rib. The other end of the rib is this whole area here, called the sternocostal joint, costovertebral joint, okay, or vertebral costal. We call it costovertebral joint. The costovertebral joint consists of two joints. One is here, one is here. This joint here is called joint of head of rib because it's the head of the rib. From when we talked about the types of the ribs, typical atypical, this is the head. This is the tubercle. So this is the joint of head of rib. This is the sternocostal joint, and this joint here is the costal transverse joint because it's the joint between the costal, the rib, and the transverse parts of the vertebral bone. So costal transverse joint and joint of head of rib together form the costal vertebral joint, and this end is the sternocostal joint. Okay, so as you can see the way it is structured, the tubercle articulates with the transverse process of the vertebral bone, whereas the head articulates with the vertebral body of the vertebral bone. Okay, very important to know. This here is a drawing of showing two thoracic vertebral bones, one on top of the other, how they are positioned. So again, vertebral bodies are the ones that carry the weight of the one above. So they would be sitting on each other, and an intervertebral disc between the vertebral bodies, the intervertebral disc. And then here, if you look here, so this is the superior inferior articular process, transverse process, spinous process. There is a facet here that is for articulation of the head of rib, and the facet on the transverse process, that is for the articulation of the tubercle of the rib. Okay, so that would be costal transverse joint, joint of head of rib together forming the costal vertebral joint. We won't go into too much detail on why they are half, because this plus this make a full circle, you see, and that's why the head of the rib of a typical had a crest and two facets, superior inferior. The top portion articulates with this one, the bottom portion this one. Okay, if this is rib 6 vertebral bone, rib 6 would be here, coming like that. Okay, this would be rib 6. The bottom inferior facet articulates with this superior demi-facet of the vertebral body. The superior facet of rib 6 will articulate with the inferior demi-facet of the 5th vertebral body. So hope you can visualize that. If I bring these two closer, these two demi-facets will make a full facet, and this is 5, if this is 5 and this is 6, rib 6 would be here, rib 5 would be here. Okay, so that the inferior facet of the head of rib joint articulates with the top demi-facet, and the superior with the bottom of the one above. If you work that out, you can understand it. Finally, I would like to just talk about the position of the ribs inside the human body. So here is the body, the surface anatomy of the body, and you can see the ribs inside. So as you can see, the clavicle, you can feel that on yourself. Use the term palpate. You can palpate the clavicle. Rib 1, rib 1 right under the clavicle. If you feel in this area, you should feel an angle, that's the sternal angle. To the two sides is the rib 2, and then you count from there. Rib 3, 4, 5. Fifth rib is below the nipple. Okay, and by the way, the spaces between ribs are called the intercostal spaces. Now the intercostal spaces are numbered like so. This here is the first, the one below is the numbers. So first, second, third, fourth, and fifth. Okay, 6, 7, 8, 9. As you can see, there's the shape of the heart. So the apex is right around the rib 5, and the spaces on two sides. Usually this space here, this intercostal space. And finally, you can feel this area here, which you can feel on yourself as well. It's like it's hard, and then it gets soft here. The abdomen starts. This is called the costal margin, because it's a margin that's made by costal cartilage only. See this costal cartilage? This is a costal margin. Okay, and that's pretty much it. And you can see ribs 12, 11, 12 there. Okay, well, I hope this was helpful, and stay tuned for the next tutorial. Thank you for watching.